time is for panel discussion 2. Designing India's future-ready healthcare infrastructure. From expanding access to care, we now move to the very foundation that enables healthcare delivery, infrastructure policy and design intelligence. Let us now move forward to our next panel discussion focused on how India will design hospitals and health systems aligned with Vision 2047. Presenting Designing India's Future-Ready Healthcare Infrastructure Policy Vision Design Intelligence and Technological Foresight for National Vision 2047. I now invite Dr. Vinod Singh, founder and consultant, Hospitech Healthcare, to moderate this strategic panel. Now I would like to call on stage all panelists, Architect Shrutri Gupta, Healthcare Facility Planner, Max Healthcare; Urvashi Prasad, former Director, NITI Ayug; Shrikant Sharma, Head of Design, MEP, Motherson Group; Deepak Nanavir, Head Engineering and Marketing, AAF International, a member of Deccan Group; Architect Shamit Manchanda, Chief Healthcare Architect, Manchanda Architects. So I will like call you on our stage. Thank you so much everyone for joining us.
Hi, good afternoon everyone. For the next 60 minutes, we're going to talk about the present, we're going to talk about the future. How many of you have seen the movies based on time travel? Interstellar, Arrival, Passengers. Okay. Let's do some time travel in this. We are sitting here today in 2026. We're going to take you in 2047. We're going to make you feel like how healthcare is going to be in 2047, about 21 years down the line. So all you got to do here is sit tight, don't go out, and enjoy the panel discussion. And before we get into the panel, I want you to imagine this. So picture this. You're in the year 2047. You step into a hospital. The moment the door opens, there is an AI assistant greeting you. The moment your thumbprint scans or your eye retina scans, you will have all your medical records being shown on a holographic display. The hospital is designed in such a way that it actually knows where you need to go. Nobody needs to tell you. Nobody needs to take you around. And then everything is happening at the back end. All the doctors, nurses, and the caregivers, they are supported by predictive analytics, robotics, and advanced AI technology. And they only focus on one thing, and that is patient care. So we're going to talk about the challenges, the opportunities, and the future that lies for healthcare in 2047. That's a national vision as to what's going to happen in 2047. Are we there yet? What things are we doing wrong? What are we doing right? And what can be done? So we have a wonderful panel here. The introduction has already been done. And I will start with one question to everyone, and that is, when you hear the term Future Ready Hospital for 2047, what's the first design principle that comes to your mind and why? We'll start with you.
Thank you, Vinod, for such a great start. And I would like to thank Mr. Afzal Kamal and entire team of Medgate for bringing us all together here. And there is a saying in India, and I would like to start sharing my opinion and interpretation on that. Pratham Sukh Nirogi Kaya. Do we have that? We are surrounded by lifestyle diseases, all of us. Duja Sukh Ghar Mein Ho Maya. With just 2.5 GDP, Indian GDP, dedicated to public health expenditure. Tija Sukh Kulvanti Nari. That is the backbone of India, the policies, the standards, regularization. Do we have that SOPs? Chautha Sukh Ho Agya Putra Agyakari. That is our population. That is completely volatile right now. and the bombarding? Are we able to control that aging population? The shooting population? No. Pancham Sukh, Swadesh mein Vasa. But are we able to stop the brain drain of India because of the lack of resources and lack of recognition right now? No. Chhata Sukh, Raja ho pasa. I rather should not discuss about our kingdom, our government, but yes, we need to enhance our policies, our goals, our government missions and vision. Saptam Sukh, ho Santoshi Jeevan. Do we have that mental peace? Or are we going through lifestyle burnout? तो कहाँ से होगा धन्य जीवन? I think it is time to start focusing rather than from reactive healthcare to PPA, that is personalized, proactive, and automatic healthcare delivery, where we do not need to design artificial intelligent hospitals. I think it's time to design artificially capable intelligent hospitals where Madhavan or Ramesh from Rai Bareli, who were supposed to have left kidney transplant, are not misoperated for a cardiac transplant. We can start with by having not just 68 facial factor node recognition, maybe we can start with 70,000 facial factor recognition. And that's how we can start with designing AI-based hospitals, smart hospitals.
Thank you, Shruti, for that detail. I didn't know about those 5 things you said, but that was kind of a learning thing for me. Shamit, why don't you go ahead with what you think about the Future Ready Hospital for 2047?
So I'm not going to be as poetic as Shruti. For me, the basic design principle is that our hospitals have to be human-centric, patient-centric, where empathy for the patients, for the caregivers of the patients is the most important point. Other are technological issues which have to be taken care of, resilience, sustainability, adaptability, digital integration. These are all secondary. But the most important point is we have to create spaces that are going to be empathetic towards the patients and how they don't feel intimidated in these places where they are already under stress. So all the issues that are going to be there, they have to point towards a human-centric hospital.
Yes, Deepak, your turn.
Okay. I will be adding what Shruti and Manchanda sir stated. Okay. When we say future ready, you demonstrated a very nice picture coming into automated doors, there are scanners, cameras, sensor, scanning your body, showing your reports and everything. But do you think by 2047, the NCR will not be the most polluted city in the world? The outdoor air,
is, yeah.
I'm praying every day it will be improved with a lot of efforts happening across government, across NGOs and the common people and all. But the air will be still bad. It is getting worse day by day, and that will be coming inside. So I come from a different background in between the architects or the doctors or the healthcare professionals. And we see when we talk about the lifestyle diseases, we can monitor what we eat, we drink. We want a human-centric approach. Then we need to ensure that the hospitals, which is considered to be a healing center where people come to get recovered and everything, should not be infected inside the hospital or got affected by the polluted indoor air inside the facility. So what I see in 2047, India should stop washing the filters, which is again a very uncommon practice, what is not across the worldwide. And then we should breathe the healthy and a pure air inside the hospital facility because that has the most active load of viruses and bacteria coming from the patients.
Yeah, about the healthy and pure air. We'll come to this in the next few questions. We'll finish this round first. Urvashi, from your perspective, from the policy side, I want to know what's something that is holding us back in getting digital infrastructure completed in our hospitals. Is there any policy that you would like to implement right away if given a choice?
Yeah, too many, I think. But I think, what we need to focus on, which is not rocket science, which is actually not AI or digital or anything, is the basic principles of public health, which I think are still missing from most of our discourse. And actually, a great hospital is one which is not overflooded, which doesn't have all its beds occupied. And that's what I always say, that if you have a successful health system, you shouldn't have all your beds full all the time and overflowing. You have to keep people out of the hospital. And that's where the focus needs to be. Whether it's clean air, whether it's clean water, our food is contaminated, our milk is contaminated, our paneer is synthetic. These are the things we need to address, which I think at this point we are completely failing to do. And while we see it happening, I think that urgency, that political will is not there. These are not mass election issues. We sit in rooms like this and talk about them. But how many people vote on these issues? Hardly anyone. So till we change that, we are not going to be able to make the kind of progress that we need to make. So all the focus for me is not on the hospital per se. I mean, obviously the hospital will remain important. But the focus for me, 1.4 billion people, has to be on keeping people out of that hospital. And that's where the policy focus has to lie. Historically, from 1947 till now, a lot of it has been on the curative side. A lot of it is on the hospital. But what about keeping people out of from there? I think that is where a lot of our thinking, a lot of technology, a lot of our behavioral science needs to go into that.
Yeah, I particularly like the fact that, when we make policies, it's not just about how we make hospital intelligent and how we make hospital better in terms of AI, but it's about how do we avoid people sending them to the hospital, which is where the public health policy comes into picture. And maybe the government needs to spend more on preventive health care rather than, since insurance has already been there, but then preventive health care is something that we should have more so that we can avoid more and more number of people getting admitted in the hospital in the first place. Because that comes first and then the AI and everything comes secondary, I believe. Thank you for that. Shrikant, from your perspective, from the MEP perspective, what do you think will be required in the future?
Like we are talking about the future ready hospitals, we must think about the heart of the building, hospital building, which is MEP services. Without MEP service, no building can run. So, if we think about the reduction of manpower intervention and lower downtime, we must think about what we can add to the system. That can be AI-based building management system or SCADA system. SCADA is a supervisory control and data acquisition system, like it said from its name. It fetch the data from every system which is integrated with these services. We can integrate each and every equipment and devices which are running in the hospital through the IoT-based sensors with AI predictive algorithm. So what AI predictive algorithm will do? It will predict the health of system with their behavior. Like we are talking about HVAC system is a critical part in any building, hospital building particularly, because it contains multiple filters like HEPA filters in OTs and other negative pressure zones, positive pressure zones. So how to sustain that system for proper working. So AI will do this, read the abnormal or normal behavior of the machine, and it fetch data from that equipment. And we can fetch a data at a single point to identify the problem which can persist in the system. Like, as of now, we know about two types of maintenance. One is preventive maintenance, and the other is breakdown maintenance. But AI will add predictive maintenance in the system. Like, we can predict what problem can persist in the system, and we can identify that problem, and we can act before the problem rises. So the AI-based BMS and SCADA system can do much better for the future-ready hospitals. See? Without increasing in manpower, without maximum intervention of human, so it can be done by AI-based BMS system.
But there's already some kind of AI integration happening in BMS to some extent, I believe, which
Yes.
can do some predictive maintenance part.
If we talk about the integration of BMS with the system, we will use IoT sensors, like Internet of Things, as we all almost know what IoT is. Today, household devices are coming with the IoT system, like geyser. You can take data anywhere, not even just where are you sitting. You can remotely access the data with the IoT sensors. So basically with the IoT sensors, and IoT sensor will provide only data, okay, right? Algorithm will analyze that data, and based on that analysis, it will provide you where the lag is coming in the operations.
Okay, thank you. I'll start with you, Shruti. When we talk about future technology, AI, and everything else, we're talking about this hospitals in metros. What happens to the tier 2 and 3 towns? Nobody talks about them. Or can they actually afford this kind of technology? That's my question.
Yes, I think that is where the role of remote AI hospitals are coming up. And we have one great example. Whenever we talk about technology, we talk and look up to China currently, in current scenario. So there is an agent hospital that has been built by Tsinghua University in China. It has only 14 nurses and 14 doctors catering to virtual 3,000 patients per day, and with a capability of 10,000 footfall consultations and post follow-up per day. They have completely set up a medical town that is AI based, and currently China is looking for actually investing $1.4 trillion by 2030 vision. And we are talking about 2047. Imagine what they are going to set up in 2047, and I read somewhere that they are developing their own sun. So imagine the technology they are going to bring in, and India has to compete. But then I think India can start with a hybrid model. We already have virtual assistants, virtual doctors, so that is helping remote. But yes, with all this integration, triage can also be remotely done with current Indian scenario, where diversity is there and scarcity of doctors we are having. Like I said, brain drain is also happening. So, and the ratio of doctors with population is quite low in India. So I think by integrating AI, we'll be able to massively cater to Indian population and somewhere improvise by reducing the load also on our healthcare staff, our healthcare teams. Currently, we are struggling with that.
Okay. So since you mentioned about China, I'm curious to know, how far are we from China when it comes to
Very
that?
far.
So what, we are 15 years behind, or 10,
Might
15
be.
years behind, or much more than that?
We just started thinking of it, and they are doing this.
Okay.
What we are thinking right now,
Okay.
they are doing this.
So some time ago, my mentor is an onco surgeon, and around 10 years ago, he asked me to design a OT for him where the interiors keeps on changing. As per his mood, there is a waterfall screen going on because they are looking at the blood all time. And of course, the interiors has to be contrasting, has to be soothing for them, all the stuff that is within the OT. So he asked me to design an OT, and 10 years later, I am seeing still not in India. But yes, outside it's being done.
So Shamit and Deepak, maybe you could focus more on the same question. What happens in tier 2 and 3 towns when it comes to technology in future?
Tier 2 and Tier 3 towns is where the growth is going to happen. And that is the area where most development is going to take place, and they're the most deprived areas in terms of healthcare. Very important is the fact that these are places which have to be developed at par with whatever it is that there in tier 3 or tier 1 cities. We need to have, as I initially said, places which are human centric, places which are adaptable and scalable, because this is where growth is going to happen. They have to be adaptable in terms of use, to be able to expand during crisis like the pandemic happened. We did a hospital in a tier 3 area where we designed the system such that a certain portion of the hospital could be segregated in case of a pandemic-like situation. A set of lifts, a set of staircases could be just cordoned off and a wing cordoned off in case there was a pandemic. And when we saw during the pandemic, there were hospitals which were either being turned totally COVID or non-COVID. We can't have entire 2 or tier 3 where the infrastructure is minimal. We can't just shut off the healthcare for that area. Sustainability and resilience is something which is very important in all the infrastructure that is going to be coming up. We know hospitals are the biggest energy guzzlers in terms of electricity, huge electricity bills, so we need to be where our MEP and green consultants come in, design which the systems are energy efficient. In terms of resilience, we're doing a project in Srinagar where the concept is that the concept arose from the fact that Srinagar had massive flooding in 2014, and so the ground floor has no critical systems there, and the building is practically designed to be earthquake proof. We usually have buildings which are designed as to be collapse preventive, that the system keeps working, but here the brief was that even after a major earthquake, the hospital should keep functioning without any break. So that is important. Digital integration, we are all talking about AI needs to be there. Did a project in Ganganagar where the client called me up and says, do you know how many kilometers of data cabling you have asked us to provide? But later on, they tied up with a major hospital chain, and one of the reasons was the systems were in place for what a tier 1 city was looking at and what a tier 3 city had provided. Very easy for them. The major hospital chain moved in and tied up with them and were running this hospital as one of their franchisees. So it is very important that digital integration is there. But one thing that we are all talking about AI is its future. But going back 10 years, 15 years, nobody was talking about AI. 2047 is 21 years down the line. Maybe we don't have AI at all at that time and we have something else. Who knows? We weren't talking about all this stuff 15 years back. 21 years down the line, there might be something totally different. So we have to be prepared for that. We have to make our hospitals adaptable to whatever new technologies might come in. And so we have to be ready for that.
Thanks. Yes, Deepak.
Maybe adding to on top of that, as you mentioned, and maybe we seen in the earlier session that the expansion happening into tier 2, tier 3 cities, up, down, up in Jammu or Pathankot and all. And then technology is helping us. Like during the COVID, when there was a shortage of healthcare workers, people were working on the telemedicine, where one doctor was attending multiple people across the India. And now with a lot of policies from the government like Ayushman Bharat, and now there is one more implementation getting added for the healthcare scheme. So that is allowing people to spend money which was not possible earlier because there were no money in the rural parts of the tier 2, 3 cities. Apart from this, the corporates are moving beyond the metro cities because the metro cities are dying. They are already dead with the traffic, with the pollution, with the scarcity of the water and everything over there. And the rising, I will say the rates or the rents specifically for the doctor or a hospital chain to invest into a metro city. Whereas tier 2, tier 3 becomes an easy investment. I will not say that is cheaper, but it is a better investment, and lot of population is staying into tier 2, tier 3 cities also because of the corporates, the work from home and other cultures. So that is driving this penetration deep into tier 2, tier 3 also. And we can see now everybody wants to move along with the technology, be future ready. So this is getting implemented across the tier 2 and tier 3 also. I have seen a solution where it's not only about building the hospital, but even analyzing the hospital. Is it rightly operated? It is rightly utilized or not? So with all the sensors and cameras and everything, you can see which area is more crowded, which is less crowded. So you can control on the number of patients into particular area. You can relocate your wards. You can adjust your air conditioning system. You can reduce your energy bills. And even it helps the architectural team also that for the future hospitals, how they can design. Like when in the first statement, when she said about the design standards and guidelines, so that is based on the previous experience. We never see the guidelines coming up on the future issues. We implemented something because of the COVID, but is it still valid? Now there is a news of Nipah coming in India. So how we are prepared for that? So these things can be integrated with the technology, with the AIs and other systems, which can help us to be prepared in advance. And that is now getting implemented across tier 2, tier 3 because you have the internet connectivity everywhere. And most of the engineers or the coding guys are coming from the tier 2, tier 3 only. So they will be happy to work in their hometowns only.
Yes. Adding on to that, since you said a lot of infrastructure expansion is taking place in tier 2 and 3 towns, my observation is that because the patient paying capacity is increasing, because the insurance penetration is growing, because the cities are getting polluted day by day. Now, what option do we as people have? We have the option of going to tier 2 and 3 towns, which are much better right now in terms of at least quality of air. We have the expansion of healthcare infrastructure happening there. And since we have insurance, and we are not going to pay from our own pocket anyways, we have the insurance. So we have the option of moving to tier 2 and 3 towns, which is where probably a better life lies. If you have good healthcare there, good air, and a better infrastructure and insurance, and I don't think, and if you can work from home, I don't think there's any reason for you to stay back in the city. Okay, so that was my observation. Coming to Urvashi, from the policy perspective, since inclusion of AI costs a lot of money, what is the government doing in terms of, empowering the rural communities? Is there any policy that the government has, any kind of investment that they are making to make the hospitals in the rural areas future ready for the artificial intelligence?
Before I answer that, just a quick point on, I don't know if this is working, on the tier 2, tier 3. They're also pretty big and growing in terms of population. So that's one thing to bear in mind. We often think of them as much smaller, but actually, you look at a Jaipur or you look at a Bhopal, or an Indore, they're not exactly that small. And they are now also facing the pressures. Look at Indore, which we say is the cleanest city in India. And we have people dying because, sewage mixed with the drinking water. So, we are pretty much ruining everything now with the environment and, so yeah, people will move from cities maybe to these places, but then will we end up ruining these places also? That's a real danger that we face today. And so the privileged are basically escaping the country, you know, because literally now in the country, I mean, Goa's air quality is bad now. You know, there was a time where everybody would escape from Delhi, whoever could afford, to Goa. But now Goa is like 200 AQI or whatever, right? Which we of course rejoice in. We think 200, 300 is great. So I think that's a big risk in my opinion. It's an opportunity, yes, but it's also a big risk that we will end up ruining those cities as well, just as we are ruining our larger metros. So we need to be mindful of that. Coming to rural, you know, hospitals and AI, and I think, frankly, most of it is pretty far from, you know, getting to that. We're still grappling with the basics of manpower. We don't have enough healthcare manpower, you know, in a lot of the rural, remote areas. And that's where, of course, theoretically, yes, AI can play a role. There can be remote consultations. We saw a lot of that happen during COVID also. There were tele-ICUs and all of that. But again, there's a lot of inequity in that. There's a lot of differences between and within states as to how well that actually gets implemented. And of course, manpower, like I said, is pretty much a challenge across the board. And also, I think just, you know, integrating AI into the workflows of people there, whether it's at the health and wellness centers that the government has, you know, set up, or whether it's at the district hospital level or, you know, whatever it is. But I think just integrating it into the workflow, people seeing the value in using that particular, you know, technology or whatever it is that we are actually, you know, asking them to use. So I think we are quite far from all of these aspects right now. In theory, yes, this is a part of, you know, most of our policies on paper. But we have very uneven implementation because it's not the central government that implements. Health is a state subject in India. So every state is at a very different level. And even within a state, you will find vast differences. You know, in terms of some districts, you will find really good work happening, really good implementation, mostly in South India. But in other districts, you know, you'll find huge gaps. So I think our problem is inequity. Our problem is that uneven implementation of the policy. The policy intent might be there, but its implementation is where we need to focus.
Thank you. Shrikant, from your experience, I would like to know about the green buildings. That concept has still been there, but then it hasn't really taken off that well because we don't see too many green buildings in India also. Okay, why is it? Is that the cost is a real concern or is there something else?
See, as far as we do design part, so we can add many things to get the ratings of green building like platinum, gold and everything. But increasing the ratings will increase the cost.
Yes.
Because due to stringent rules and regulations, we'll have to implement to get that green building concept rating. So yes, cost is a major cost has major impact on everything. Not even just taking the green building, implementing new technologies has a cost. But one thing I must add in that. If I talk about any corporate hospital or anything, management thinks about capex.
Yes.
Capex is the biggest challenge because they don't want to invest huge cost, but they don't think much about the opex. That if you advance your system, if you upgrade your ratings, yeah, definitely it will have a cost. But it will reduce your operational cost. So we must think about that while we design, while we implement. And yes, as ma'am said that we can implement AI and everything. Integration part is the major challenge. See? But as we are talking about future ready hospitals, in 2047 and 2050. Do we have sufficient doctors right now over the number of population? Do we have? I think no. And what do you think? After 50 years, we will have that number of doctor in respect of the shooting of population? It still will be a challenge at that time, also, as I presume.
You know, I'm so fascinated by AI and technology and everything. My only fear is that it shouldn't become another green building kind of thing. Because, you know, we have green building, everything is good, but then it costs money. But then not many hospitals implement that because it's not really that much required. Okay, from the CapEx perspective, yes, please go on.
I'd like to interject here. You started off with a statement that we don't have too many green buildings. In fact, the Government of India mandates that all projects which have funding from the center or the state should be minimum 3-star GRIA rated projects. So that cuts away. All government projects are green rated. And
here comes the role of government, sir. Here comes the role of government, sir.
Yeah, but also as Shrikant just said, the aspect of bringing in OPEX is very important, and most intelligent clients understand that bringing down the running cost of the project is very important, and you just have to tell them that, okay, you are going to spend 4 or 5% extra in your capital investment, but after 3 years, after 4 years, your energy bills are going to come down. And they are ready to listen to that. They understand the financial implications, the initial capex and the opex they will be saving. So that becomes very critical. And it is not only 4 or 5%. Many a times, good design itself can also bring down the energy cost. How you orient the building, how you orient the openings, how mutually shaded the buildings are, how green the building is. So many aspects of green building have no cost. Passive measures can be implemented so that the green building rating can be achieved. Rating is basically a system of quantifying how your energy savings are happening. What I mostly tell that any good architect who is designing a building without even going through a green rating process would, if you just analyze their buildings, it will already be 3-star rated. You do bring in orientation, you do bring in STPs, you do recycling of water, you do energy efficient systems in terms of air conditioning or other pumps, etc. All these put together and you will achieve a green rated building even without going through the formal certification process.
That's right. I think we are almost out of time. I'm not sure if I took you to the future, but then we tried our best. Okay, quick show of hands. What do you think is more important in the future? Is it design, is it technology, or is it operations? Quick show of hands. What do you think will be more important in the future? Design? How many for design? Hospital design. What do you think will be more important? Okay, so we have only about 4 or 5 people for design. Who thinks technology is more important? Okay, and who thinks operations will be more important? Oh, so nobody's talking about design much? Yeah, sure. Go ahead.
I think all three of them are important because they have to go hand in hand. Operations without technology will not succeed, and design without integration of operations will also not succeed. That's why I said we need to start, India needs to start with the hybrid models. Like Urvashi also said that, currently the scenario in tier 2, tier 1 cities is very poor right now than what we are expecting to have in 2047. So maybe we can start with robotic pharmacies. We can start with, we already have PTS system, that is one also part, and Mr. Shrikant also mentioned. Sir also mentioned, Samit sir, that we need to have green building incorporated in the design, because this is going to help in every aspect. And we all keep on thinking that AI is going to take our jobs. That is exactly what we thought when computers came in, laptops came in, phones came in, and now we are carrying them in our bags and everywhere in our hands. Mobile phones, I guess, are more important for everyone than roti, kapda, makan right now. And I think human intelligence, in my opinion, is irreplaceable. It will always be there.
Thank you very much. Just my conclusion on this. See, why we talk more about technology in conferences like these? Because human beings have a limit to achieve certain things in terms of maybe patient care or treating patients, or in terms of designing buildings. But technology has the power in order to probably replicate things multiple times, and can be done things on a larger scale, which is why we talk about technology. So that's exactly the challenge with future-ready healthcare, that no single answer is the right answer. We need everything: design, operations, technology, and we need all these experts to guide us in the future also. And I look forward to seeing this wonderful panel in the future, maybe somewhere else, talking about something else. And not sure if we have some time for questions. Do we have time for questions? Anybody has any questions on the future?
Any
Or present?
questions, anyone?
Or challenges, anything? Great, we have a wonderful audience. No questions, so we end it here. Thank you so much once again, everyone.
Thank you so much, everyone. Please be seated. I would like call on stage Mr. Afzal Kamal sir and Mr. Dr. Professor Rajesh Shah sir on stage. Can we have a round of applause for them? जोरदार तालियां हो जाए हमारे मेहमानों के लिए. Thank you so much, everyone. So, ladies and gentlemen, now is the time for short break for 20 minutes. तो जाइए, कुछ खाकर आइए, फिर आगे कंटिन्यू करेंगे हमें इसी डिस्कशन को. थैंक यू एवरीवन. सो एक छोटा सा ब्रेक है 20 मिनट्स का. मिलते हैं 20 मिनट के बाद. थैंक यू सो मच.